My name is Rhea Tolles. I'm here with Danya Pinson. She works for Washington State Healthcare Authority. We're doing an interview for our Beneath the Surface series. Beneath the Surface are interviews we're doing for BioClean that talk about mental health awareness with people that are in the industry, business owners, or just anyone that deals with mental health directly. So we are here to talk about that and just give some thoughts and ideas. So, okay, hi Danya.
Hi.
So, can you tell us, what do you do?
I currently work for Washington Healthcare Authority. Um, I don't deal with, I guess, patients directly, but I've been in the healthcare community for over 20 years, and I've worked for Western State Hospital. I work closely with psychologists. I've worked at multi-care. So I've been involved with agencies who support the mental health community.
In what way does mental health awareness and advocacy tie into what you do in the company you work for?
Well, for Washington Healthcare Authority, we are big advocates for providing like resources to the community, links, phone numbers. We try to, if we don't have the resources, we'll, give those in need or who are seeking mental health care, provide them with names of other agencies that might be able to help them. Washington Healthcare Authority provides like Washington Apple Healthcare, which is for low income, individuals out there who don't have, who can't afford, even basic health care. So with Apple Healthcare, the mental health community can go out and like try to find, a therapist or counseling. And along with that, they also, most counseling and therapists provide other resources and things that you can do for your mental health.
So you talk about you have like case files. Do you directly deal with people that are mentally ill, or do you just look at case by case?
Yeah, so I'm in public disclosure currently, but it's all agencies like mental, like I would say like DSHS, your public health agency, Western State. We are all agencies that are big advocates who are trying to help the mental health community. For me right now, I don't deal directly with mental health community, but we are, we as employees, us as an agency, we are always trying to be advocates to support those who are in need
Who really need it.
Yeah, who really need, support or guidance or, a friend, a phone number. So that's how I feel like I support the community, mental health community. For example, if I'm working with a client and they email me back and say, the reason I'm requesting these records is because, I'm currently going through, a situation. I've had a death in the family, or I've had, I'm having some mental health issues, and I want to prove that that I've had these mental health issues in the past. So what I do is I will dig for, prior history for them and provide that to them so they can go and seek,
Help.
get referrals or in, uh, you know, um, there's times when, agencies will give out grants or, more funding if you have referrals or background history in mental health. And so it's just easier sometimes to seek help or get help when, um, you know, there's a history with mental health,
Yeah.
So, yeah.
what inspired you to become an advocate for mental health awareness?
I've had close friends
Mm-hmm.
and family members, even recently,
Mm-hmm.
um, you know, uh, unfortunately commit suicide.
Mm-hmm.
Um, and I think that runs deep in the mental health community when they don't have those resources.
Mm-hmm.
So for me, if I've personally gone to um, I go and research myself,
Mm-hmm.
like YouTube or like books or um, that's why um, because I've had that recent and past experience with
Mm-hmm.
people who suffered from mental health and didn't seek help.
Mm-hmm.
That's why now I've become more aware and an advocate. Like,
Mm-hmm.
what can I do to help this person?
Right.
You know, um,
Mm-hmm.
and I think that any, being an advocate for mental health, you become an advocate when you start, being aware. That
Yeah.
makes you an advocate right away because
Right.
once you become aware, then you can know how to, help maybe start helping this
Right.
person,
Mm-hmm.
and also help yourself because I
Right.
think that everybody, I think
We all have
we all have mental
some.
health,
Yeah.
issues, or maybe not at this time, but
Mm-hmm.
maybe in the future. You
Right.
know,
Right.
I think that society is,
Right. They
it's
hide
hard
it.
on
Yeah.
people
Right.
out here right now. So
So, with your experience with work and what you've been through, what do you think are like the misconceptions for about mental health going going
uh,
along with that? Yeah.
so
Mm-hmm.
I have misconceptions that I think that people have about mental health is that
Mm-hmm.
uh, that people are either you know using drugs or are less intelligent. Um, they're just seeking um,
Attention.
attention,
Mm-hmm.
and that's really unfortunate.
Yeah.
And you know, those are those I would say stigmatisms cause people with mental health issues to not seek help. And
Mm-hmm.
it cause mental health, like I said, it hits everybody. It hits your neighbors. It hits your
Mm-hmm.
mom. It hits your sisters. It
Mm-hmm.
has no, you know,
Right. Yeah.
you know, it doesn't pick and choose. It just happens,
Yeah. Right. Right.
So I can't think of the word, but it's like I can't think of the word, but
Mm-hmm.
you can, it's not like, it says, oh, you're not going to have it, you're not going to have it, you're going to have it,
Yeah.
it,
Right.
yeah,
We are dealing with something.
hmm
Either it's big or small, but it's something.
yeah,
Yeah, for sure.
yeah.
So you were just talking about this. So how do societal stigmas surrounding mental health impact individuals seeking help? So you were just saying it's
Yeah. So, you know, s- s- society, when they put those stigmas on mental health, it can cause a person with mental health issues not to seek
right.
help
Like you
because
get
they don't,
embarrassed
yeah,
and
they
you're
get embarrassed,
mm-hmm.
and it prevents them from, you know, seeking the
Or
help that
calling
they,
someone and talking
yeah,
about it with someone because they're embarrassed.
yes, they're embarrassed and they're afraid they're going to
People
be
are saying they're getting
targeted
yeah,
or bullied.
they're weak.
Yeah, they're going to be labeled as weak,
Mm-hmm. You're getting attention.
Yeah,
I've heard all
things
that
like that.
before. Yeah.
So, I think that, you know, it's unfortunate that society, labels mental health issues as
Mm-hmm.
that. So,
Right. No, I
yeah.
agree. So, what do you do personally as a coping mechanism to deal with your own mental health? What do you do?
For me, it doesn't, the everyday norm, like people say, well, for me personally, like I read, I walk, I try to take time out every day just to stop for like 10 minutes and have silence.
Mm-hmm.
Um, and I have conversations with myself sometimes.
Yeah.
I honestly do. I talk to myself sometimes and look in the mirror and say, "You've got this, Danya.
Mm-hmm.
Um, like, uh, you're not abnormal because you feel this way or you're thinking
Mm-hmm.
this way.
Mm-hmm.
but what can you do? What can I do right now to make myself feel better? So I start listing all the things in my head about my life, like that aren't so bad. You know, things could be worse. Like I have a roof over my head. You know, I just start trying to think about the positives in my life, and then I also have, you know, honestly, I have great friends that I can call, and I'll be like, hey, you know, I'm thinking about this or thinking about that, or, you know, if I feel like crying sometimes, you know, I cry. That's
Yeah.
another mechanism for me.
Yeah.
I cry if I want to.
Yeah.
I don't hold back. You know, if I feel like I need to do something, like I will stop and say, this is for my mental health. I'm going to
Right.
do this.
Right.
You know, if I feel like self-care, like if I haven't, you know, uh, you know, I'm going to say take a shower or
Yeah,
like
right.
curl my hair
Yeah.
or,
Look
you know,
good.
put some makeup on,
Yeah.
you know, those little things
Yeah.
help me get through the day,
Yeah.
and they help with my mental health. You know, being a person of color, um, society is, uh, you know, already labels you sometimes. Some people look at you as a person who might have aggression or, you know, so that's just society
And you know what I'm
sees.
asking too is because you're Native American.
Yes, I'm Native
And
American.
then do you think that they have the stigmas on them
Oh,
with
absolutely.
mental
Like
health?
mental
Yes.
health, you know, substance abuse, things like that. Like we're already labeled to have those um, negatives in in and around us in our community, you know. And so uh, those are, but it does run deep. I mean, my
Yeah.
sister, um, Jennifer, you know, she struggles every day with her substance abuse, her drinking, you know, her mental health. And she recently just um, got out of rehab, you know. And she doesn't want to be that way.
Yeah.
It's just, she has weaknesses, and,
She
you
has a
know,
disease.
she has a
Yeah.
disease.
Yeah.
And again,
Has it been hard for you both or cope? Were you taught differently as far as coping?
well, you know, um, my mom came from the reservation, and so we were on the reservation a lot as we were growing up. So mental health was never, you know, talked about, you know,
Yeah.
growing up, and
In my family too. Yeah.
yeah, anything we felt, it was like, you got to deal with it. Just deal with it. It was just brushed under. We never had conversations about mental health and things that we could do, or, you know, positive affirmations about,
Yeah.
you know, who we are, or the possibilities of prospering outside
What's
of,
out there?
yeah, what's
Oh,
out there,
yeah.
you know.
Yeah.
So, you know, that it's unfortunate.
How did you get through those barriers though for yourself?
Um, honestly, um, I have met great people. I had friends who, and certain family members that did recognize, you know, because did recognize mental health, because they've had mental health issues in the past, and they've learned to work through it. So guide, it's just having a conversation,
Being
but
open.
being open, yeah. Um, you know, honestly, when I was in high school, and you know, I ended up meeting some great girls who had great families. I mean, no family's perfect by any means.
Right.
They all had, you know, home issues, but overall, you know, they showed me like there's, you know, there's ways to deal with this and your mental health, and there's positives out there, and
There's a big life out there to
yeah,
live.
you know,
Yeah.
you got to try to be your own advocate sometimes, you know,
Right.
to
Oh, yeah.
help you get through situations.
Yeah.
So, you know, it's sometimes just people talking to you, and letting you know that there's a different avenue,
Right.
um, to get out of, you know, certain situations.
Right. And that's the answer for the next question. What are some ways friends and family can support a loved one struggling with mental health? It's just really being there for someone.
Yeah, calling, you know, and I know everyone has a busy life, but if you could just take time out to call that person, make time to go take a walk with them, you know, make a list of phone numbers and resources that they could, you know, if they're having a weak moment, or they can call one of those phone numbers and let them know that you're absolutely available 24/7. Don't ever be afraid to call.
Right.
You know, and really listen to them when they're talking to you about what they're going through mentally.
Right.
You know, and don't judge.
Yeah, no judgment.
No judgment.
Yep.
Please don't do that to
No.
people.
No.
Yeah.
I know how that is.
Yeah.
Yeah.
So,
I'm sorry I had to bring that up because I think it's really important to showcase this, how you are a woman of color, and from you're Native American.
Yeah.
I think it's really important to say, like, there are stigmas, especially in your culture. You know, there are stigmas in that. So I had to bring that up.
Oh yeah, no, I appreciate that because it's real.
Yeah.
I mean, I have, you know, aunts and uncles who, you know, have schizophrenia. You know, I have had uncles that have committed suicide. You know, we didn't know that they were depressed.
Right.
And you know, we've had, you know, the society with the what is it?
LGBTQ.
Yeah, TQ community. Like those things weren't around.
Right.
You know, even, you know, that type of support wasn't around.
Right.
What, even 10 years ago? So,
Right.
you know, they struggled.
Everything's, I think, generational right now, how we're dealing with this issue.
Yeah.
And from even 10 years ago, 20 years ago, everything was so different.
Yeah.
And how people are dealing with it. Right now, we're just talking about it.
Yeah.
Now it's a thing, right? We
Yeah.
need to talk about it. But before, we never,
Yeah.
in my household, I mean,
No.
I had huge mental health in my household. But to talk about it was like really awkward.
Yeah. Yeah.
We never do it in front of a camera like this,
Yeah.
you know? So, yeah.
You know what else I find, like with, surprising is that when COVID hit, there was so much workforce that came together to try to find ways to get through that pandemic, right? And here we are, it's 2024, and we are still fighting, just hearing even in the state of Washington, to try to find ways to help the mental health community. I mean, there's not enough, you know, psychologists, there's not enough resources, there's not enough places for people with mental health to go to, you know, it's unfortunate.
They can afford.
Yes, that they can afford. You know, finance is a big thing.
That's what we hear all the time, is people calling for our services, but they just can't afford it.
Yes.
And then us struggling to find the resources, like your organization or other, to help.
Find funding,
There's not a lot out there, and your organization's also probably like the others, where they're just bombarded trying to help and fund or do whatever they can, but it's just too much. And like you said, there's just not enough.
And there's a lot of therapists and counselors and psychologists right now that are just overloaded.
Yeah.
You know, I mean, and you have a lot of them working, you know, like I said, state agencies, like, you know, Western State Hospital is a big one. They have many psychologists.
You were there for a long time,
yes,
right?
I was there for 5 years.
Yeah.
And I worked closely with a psychologist there, and they were also overloaded with all their cases. I mean, you know, their goal is to help. What can we do to help?
Yeah.
And
how can you do that when you're like rushed, right?
Rushed,
with all the cases.
And there's just not enough resources and not enough time in the day.
Right.
You know.
Right.
So
what do you think how do you think technology and social media is influencing mental, positively and negatively, though?
Yeah. So positively, I think, you know, technology, you can find resources, you can find, that's the thing. Positive body image, you know, you could find happiness on the internet, on technology, you know. For me, I think those are, to me, good positives, you know. Negatives, I think,
A lot.
Yeah, there's more, to me, there's more negatives than
Yeah.
positive, unfortunately.
Yeah.
Because I think that society, again, will show a person with mental health that they're, drug users,
Mm-hmm.
um, that they unintelligent,
Mm-hmm.
uneducated, um, or, they are, uh, you know, they don't fit society's body
Right, and that's why there's
image.
filters.
Yes.
That's why there's those
Yeah.
make you look skinny and you
Yeah.
look great. It's all that, and then what do men call
You-
that? Well, they're like catfishing.
Yes. Yeah. So, and that's the thing. You
It's just
already.
everything seems so fake.
Yeah.
And yeah.
Everybody's built different. Everybody's
Mm-hmm.
different, and so when you get on the internet and you have, like you said, these filters trying to
Mm-hmm.
make you think that you should look a certain way,
Mm-hmm.
or be a certain way, or
Mm-hmm.
have a social life in a certain way,
Mm-hmm.
you know, it makes people depressed when they don't have
Yeah,
that.
they're like,
And
I don't have that. I don't
yeah,
have that nice car or
car or
house
house,
or
yeah,
yeah,
you
yeah.
know,
That can, especially with young kids right now,
yes,
and
oh
they
my
see that
goodness,
and they think they need to live up to that.
yeah,
I mean, the work ethic is gone. It's like,
oh
how do
yeah,
I make the money fast? How
yep,
do I be an influencer? How do I do all these things?
hmm,
Where that I feel like is negative towards youth,
yeah,
right now.
oh yeah,
The
there's, it
sense of
is,
entitlement
mm-hmm,
is just even worse because
mm-hmm,
of social media, I think,
yeah,
And so the work, where's the working hard again and earning that money and all of that is
all that
just,
wears
I
on
feel
our
like that's
children,
gone a little bit more out the door with social media.
yeah,
Yeah.
well, and the like you said, the mental health, the stress
Mhm.
that our kids
Mhm.
are going through to hold up this, you know, facade or this
Mhm.
image
Mhm.
that they
But
think they should have.
yeah,
It's
but there's
horrible.
also a lot of bullying.
Yes,
If they're
yes.
not
If they're not,
like
yeah,
that, then there's
yeah,
so much bullying, and
yeah.
that's where mental health comes in with suicides and stuff like that, because you're watching and you're experiencing these people leaving you bad comments and
Hmm.
awful things. Can you
Yeah.
imagine growing up like that?
No.
I can't. That's why I was just saying the other day about, I was like, I cannot even believe, like, to I would be a wreck.
Yeah.
you know?
It's happened throughout time.
Yeah.
I mean, uh, uh, I've watched people be bullied,
Yeah.
and I myself have been
Yeah.
bullied.
Yeah, me too.
You
Mhm.
know, yeah, and I think that when you go through things like that, you're too afraid to say something, and that's unfortunate.
Yeah.
And many kids, and it doesn't matter if you're a boy or girl, things could
Mhm.
happen to you when you're young, and then you
Mhm.
don't wait until your adulthood to say
To say
something,
something. I
and
mean,
that
you and I probably experienced the racism. I've been
oh
called
yeah.
all kinds,
Hmm.
goop,
They
chink, all
don't.
of it.
I
Been
was
called
trying
all
to
of it.
think of the word earlier because they don't say racism anymore. They say it's bias. I couldn't think of the.
Mhm.
Uh, how I had it on my mind the other day, but anyhow, it's something. It's a word that involves bias in there. Like
Mhm.
it was huge on, especially when the legislation's talking or
Mhm.
the news. They don't
Mhm.
say racist anymore. It's
No.
like it's that
Yeah.
word, it's impartial
Right.
bias or something like
Yeah.
that. I
Yeah.
can't think of anyhow. Um, yeah, but yeah, I mean, all those things, play into causing people to have mental health. Whether you be an adult
Mhm.
or youth. It's unfortunate
Right.
because at the end of the day, this is what I say: we all bleed the same.
Yeah.
Our cultures are all different. Just
Mhm.
have respect for that.
Right.
you know and I think it takes time to have that mental, like, to be okay with yourself.
Oh yeah.
Eventually, as we grow older, as we become adults, you
Mhm.
start to learn that all those things that may
Mhm.
have caused your mental health, um, but it's hard. It's because it's not just also society, but it is what you said, it's a disease.
Yeah.
you know
Mhm. Mhm.
there's psychosis out there that people can't they can't manage. Like my sister, like I said, my prime example, if she does not take her medication, she has a chemical imbalance in her body, and so that medication, and that's another thing that you know we need to have more resources for the medication that's available out there for the mental health. You have to make it affordable.
Yeah.
People cannot afford it.
Right.
So,
oh
yeah.
gosh, it's so expensive. I know. Yeah.
Yeah.
So what are some, you think, resources or support networks for people that may not have access to like the traditional services like counseling and therapy? Do you know any of other networks or support services out there?
You
Or
know,
what's your best knowledge of what people can do if they can't afford?
so before I came to this interview, I started to do a little bit of research, and to be honest, there isn't a lot out there unless you have access to the internet. Um, you know, it would be hard for you to find resources. So right now, what I've seen, the best avenue is the internet. Getting on there, and like I said, good place to start might be DSHS, their website. They have many links on there that can lead you to find a clinic or some sort of counseling therapist. Places. I believe there are a few places even around here in Tacoma. I don't know the name of them, but that you could stop at, and if you're feeling like you need some counseling right away. You can always call 911
or 411.
the non-emergency.
So I think it's great that you said internet, because I think social media, I know we talked about it, but there are groups out there. You have to be careful, but there are some online communities, I feel like, that people gather together and they say, oh, I know this person, I know that person, you should go here and here and here.
Yeah.
I think a lot of people wallow in their homes like, I don't have anyone. But, I think there are places you can research, like you just said.
Yeah.
And
I
find.
think, one of the biggest things is tragedy. Tragedy in people's lives can bring you to your knees. And when you feel like, I don't want to burden anybody with my tragedies, you just sit there and you do nothing, and then it causes even more anguish.
You're right.
But I think when you're going through tragedy, you need to let somebody else know so they can help you find the resources that you need. When my sister was going through all her recent tragedies, I got on there and I found a community, a support group in her where she lives for grief counseling.
Yeah. Yeah.
And those resources are out there. You
just have to look.
Yeah. But sometimes when people are going through grief, that's not on their mind.
No.
Right? So they need that. Right. They need their advocate. I've been a big advocate for my sister. Helping her find those resources and talking to her every day. Like, I'm so glad that you're, doing so well. You look so happy. You look healthy.
Yeah.
I'm glad that you're taking that time to self-help, self-care for yourself.
Because we need that. We all need someone like that.
Yes, we do.
To remind ourselves, right? To remind us, like, we are great people.
Yes.
We're good. We're beautiful.
Yes.
Yeah. Sometimes.
Yes.
I mean, we should do it for ourselves, but sometimes there's a day where I'm like, I don't know. I'm not feeling good about myself. I need to call you, Danya. Tell me.
Yes.
Yeah, I know. So how do you recognize when it's time to seek professional help? What are some triggers or some red flags?
So for me, there's days when I'm just going to be honest, when I don't want to get out of bed.
Yeah.
When I'm having negative thoughts. When I am just hiding. Those are when I stop taking care of myself. So like I said, when I'm laying in bed all day, or like when I find myself not wanting to shower for a couple of days, not work out, not get out of out of my little hole, those are the days when I start thinking to myself, okay, you know what? I need to be more
Right.
more active in trying to find some care for myself. So I recently reached out to my doctor, and I didn't even have to go in. I made a phone call and said, "Listen, I feel like I'm depressed a little bit. I've had some things happen in my life, and I really don't feel like I don't have any energy. I don't get to get up and get out. So she prescribed me some medication, um, but those are those are my triggers. Like I said, days when I don't want to get out of bed, when I'm being recluse, I shut my friends out. Um,
Yeah.
those are definitely triggers for me that I think something's
Same.
wrong.
Yeah.
So
I'm the same way.
yeah,
I won't get out of bed, or I don't want to do nothing.
Yeah.
Yes. um, so what are the challenges you think that the common challenges people face when they're out trying to get some mental health help?
I think a big one, and I think we kind of touched on this, is it's financial.
Yeah.
Financial. I think a lot of people cannot, afford the counseling, the therapy, the medication, um, and that's just if 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 any one big thing, to me, that's it.
Oh,
Plus,
yeah.
well, also, like I said, I don't think that there's enough resources out there, like on hand.
Right.
Resources. You have to do some research. You have to make an appointment. I don't think there's some. I'm trying to think of the word where there's just some automatic resources out there for people. Someone,
It's hard to find.
Yes.
Yes.
It's unfortunate, but like I said, you can, you know, call DSHS, look on their website. You can even call customer service and say, "Hey, I'm having some mental health issues. Can you guide me? Can you point me in the right direction? Who can I call?"
Yeah. I hope someone sees this and hears us talk, and then they can comment like, "Oh, I know someone. Oh, here's a resource," because it's always like by other people too.
Yeah.
I feel like,
Yeah.
and you're in the government sector,
Yeah.
so you kind of see like the things
Yeah.
that.
Like I said, to me, in working in the healthcare industry and working for state agencies,
Yeah.
one of the biggest things I said is it's financial. It's funding.
Yeah.
It's financial. A lot of people don't have health care out there. They don't have health insurance. So when people don't have health insurance, they feel like
There's nowhere to
there's
go.
nowhere to go.
Right.
So they just suffer.
Yeah.
And that's unfortunate.
Oh, there's so much out there.
Yeah. And
I agree.
yeah.
So, how can workplaces create environments that prioritize mental health and support employee well-being? So, you're in an organization.
Yes.
I've worked in corporate America. Like, what do you think how employers can help with that?
Well, working for Washington State Healthcare Authority currently, I mean, they are big on work-life balance.
That's good.
So they offer, like, we have a workout room.
Oh, nice.
They make sure to remind you to take your breaks. Go take a walk. They
That's
don't even
great.
care if you're gone for more than 10 minutes. If you need that extra time. I think it's important for employers, to have PTO, paid time off, so people can have self-care.
And not make you feel guilty.
Yes, do
to
not
take
make
the
them
day
feel
off.
guilty, because people, you're human. You can't work every day and not take that time out. I mean, there's days like, for me, like Sunday's usually my day to not do anything. I don't make any obligations or promises to people. I dedicate that day to myself. But for employees, they're like, also with Washington State Healthcare Authority, they offer EAP, which is Employee Assistance Programs, where you can call and it's confidential, where you can seek counseling.
Wow.
Yeah. Yeah.
Gosh,
So
that's amazing. I wish everyone had that.
yeah,
You know what I mean?
but not a lot of companies can afford that.
Or just for people that need it.
Yeah. Just that phone call away. There's
Yeah.
resources, like you can call them, the Employee Assistance Program line, and it's an 800 number, and you tell them what you need, and they'll get back to you. They'll email you. They'll call you and say, we heard you're looking for this type of resource. Let me provide you with these phone numbers, or,
Wow.
things like that. Yeah.
Yeah.
So I think, just those 4 items, can really help.
And that
um,
helps employer retain employees too if they give
yeah.
those
Yeah.
resources. Yeah.
And, now I know about your business. I've seen on the internet how you guys get together in your morning huddles. And I
Yeah.
think that that's important to have
Yeah.
great communication, open communication, no judgment.
Yeah, no
So,
judgment for
yeah.
sure. I mean, just being there for each other and talking about things honestly and open and
Yeah.
not feeling like you're going to get in trouble,
Yeah.
for it.
Yeah.
So, but
Good.
I know a lot of workplaces have those issues where people feel like their job might be threatened if they say too much,
Yeah.
which I believe you have to always just be really honest and open, and maybe it's not the right place for you to work at if you can't be.
And don't, like I know we've said this a few times already, don't judge. Be supportive.
That's a big
Be
That's a big deal today.
Yeah.
That's our motto.
Yep, absolutely. Be supportive and no
Yeah,
judgment.
Right, there you go.
Yeah.